Red meat causes heart disease. Increase in saturated fat in your diet causes an increase in your LDL, and there's a linear correlation between LDL levels and cardiovascular disease, which would fall in line with the American Heart Association guidelines from 2013. See, they have a calculator where we can take a few basic risk factors and they will spit out your overall risk of cardiovascular disease. Now let's input normal range numbers with a high cholesterol, and it will tell you that you have a 50% chance of heart disease. But see, even the American Heart Association is starting to realize that there's a little more nuance to heart disease. They came out recently with a new calculator. What would our risk factor look like if I just took normal standard averages for a relatively healthy person? I'm going to max out total cholesterol to see how much that actually affects our potential risks. The average HDL, 40. The average systolic blood pressure, 124. Average BMI of 29.1. An eGFR of 99. A UACR of 17. And an HbA1c of 5. All of these factors put in that our risk of heart disease over 30 years is 13%. When you look at the fact, 75% have heart disease. Maybe it's time everybody else got on the train of not just looking at LDL and looking at other metabolic factors. Even with maxed out cholesterol numbers, I'll still take this 13% that is almost 6 times lower than the average American's risk of heart disease.